as a community for AAPI, what really is our next step? You get to a point where people say enough is enough. We can only take so much.
Hi, I'm Dr. Keshishian. Welcome to our podcast series, House Calls with Dr. K. During this series, we're going to talk about many different things, but specifically, it's about medicine, the human side of medicine. We all have questions about our health, and who can you turn to? The providers that you trust. Thank you everyone for joining us. DHS and LAC+USC are united against hate. Today we highlight our Asian American Pacific Islander community. I am joined today by Dr. Wei-On Andy Lee, who is the Director of Specialty Care at LAC+USC, and he will be our co-host today. Dr. Lee?
We're having this town hall meeting to show solidarity with our Asian American Pacific Islander community in condemning hate. As you've seen in the news, there has been a rise in anti-Asian American hate, and we're having this town hall with various members of our healthcare community to show that we stand together to condemn hate and these events. I'm proud to be part of a healthcare system that condemns hate. Our leader in this system acknowledged that anti-AAPI racism exists and are committed to action. Last week, our Director of Healthcare Services, Dr. Christina Gali, put a statement out first acknowledging the long-standing anti-AAPI racism that exists in our system and institution. In our town hall this week, our CEO, Mr. Jorge Orozco at LAC+USC Medical Center, acknowledged that anti-racism exists and is committed to addressing this issue. Furthermore, he committed to action, and this is why we're here today, to have a town hall panel discussion and a follow-up sports round at the LAC+USC Medical Center. So with that, we're going to start some introductions. Let's start with Dr. Arun Patel, if you can introduce yourself.
Thank you, Andy. My name is Arun Patel. I am the Director for Patient Safety, Clinical Risk Management, and Compliance at the Department of Health Services. I am an Indian American and a first-generation immigrant. I moved to the United States when I was about 1 year old and spent most of my childhood living in Mississippi.
Hi, my name is Hyung Taek Henry Kim. I'm the Associate Medical Director at Olive View UCLA Medical Center. I'm a Korean American who immigrated to the United States at the age of 13. Grew up in Los Angeles, but did my training at Pittsburgh as well as Baltimore, which has a little different experience than LA County.
Good afternoon, everyone. My name is Annie Marquez. I am the Interim Chief Nursing Officer at LAC+USC Medical Center. I was born in the Philippines. I am a Filipino American, and I can read and talk and write, Tagalog, which is the national language of our country. Mabuhay. Thank you very much.
I'm Dr. Andy Lee, and my Chinese name is Wei-On. I came here when I was 6 years old, and I immigrated here with just my mother and my sister, and we lived in West Covina. Later I went to up north in Berkeley, where I had a chance to meet other Asian Americans, and it's with that I have connection to the Asian American community, and now I'm the Director of Outpatient Specialty Care at LAC+USC Medical Center.
Hi, I'm Richard Watanabe. I'm a professor in the Department of Preventive Medicine at the Keck School of Medicine at USC. I'm also Associate Dean for Health and Population Science Programs. I'm a fourth-generation American of Japanese ancestry. I'm also a volunteer docent at the Japanese American National Museum in Los Angeles. I'm currently the chair of the volunteer council for that museum. And I also teach Japanese American history to all the new volunteers and staff.
Hello everyone, I'm Anna Xiao. I was born in mainland China, and I came here when I was 22 years old. And I'm currently Associate Chief for Psych Services here at LAC+USC and Vice Chair for Clinical Affairs at Department of Psychiatry with the USC.
Hi, I'm Hal Yee. I'm the Chief Deputy Director and the Chief Medical Officer for the Department of Health Services. My maternal great-great-grandparents emigrated from China to the Kingdom of Hawaii 135 years ago. That was a dozen years before Hawaii was annexed by the United States. In other words, half of my family did not immigrate to America. Actually, the Americans immigrated to Hawaii.
Hi, I'm Ray Samoa. Let me end the mystery. I am Samoan. I am on faculty at City of Hope. I graduated from endocrine fellowship at LA County USC and actually became the first Samoan endocrinologist and the only Pacific Islander endocrinologist on the continent. I am the lead for the National Pacific Islander COVID-19 response team, and I am also on faculty at Harvard UCLA.
Thank you to all of our amazing panelists for being here. Now, you all are so diverse and have such an interesting background. Can you maybe talk about how your heritage has shaped the person you are today?
So I have to say for myself, my father, even though he was actually born in LA County Hospital, but when he was young, my grandfather took the family back to Japan. So he actually was raised in Japan. They went back when he was about 3 years old. And he came back to the United States post-World War II when he was 18. My mother is actually a Japanese national. And so I was raised more like a traditional, in a traditional Japanese family in some sense. And so I've always had traditional Japanese values. When I finished my PhD and went off to do my postdoc at the University of Michigan, I suddenly realized how much I had taken my community for granted. Because when I went to Michigan, suddenly all those things that I was involved in disappeared on me. And there were no Japanese American groups there, nearby at least. I mean, there were in Detroit, but that was a little too far to go to. So when I returned to Los Angeles, I decided that I needed to be more involved in my community. And this is one of the primary reasons why I started to volunteer at the Japanese American National Museum.
Yeah, I find that comment when you say you've never really connected with your community back when you're young. I think I had the same experience when I was young as a first generation immigrant. I would say pretty much in the 80s, I was like any other American kid who was like a latchkey kid, right? The mother, my single mother pretty much worked and went to school. The kids did their own thing, and we just felt we were American. But as a first generation, though we get some of these comments, we just thought it was just normal, right? And it wasn't really until when I went to college, when I started to understand with other Asian American members and started to mature and understand really our place here in the United States, that I started to connect more with my Asian American roots, and I think there's actually a lack of Asian American history in what we learned. So I identify with that. So, and it was until later that I started to meet more parents. I think I would say more parents with kids that are Asian American, that I wanted to make sure that I myself was educated more about our roots here in America, as well as my roots back in Taiwan, to be able to pass that on to my kids. So
Yeah, we didn't immigrate, so my family came here because my dad was given an assignment from his job, to LA, and we came as a family to support him. And a couple of years later, that when he was summoned back to Korea, we decided to stay because my parents felt that the education, the opportunity was so much greater in this country, and decided to stay and pursue residency as well as finding a new home in the United States. When I first got here, we were told to assimilate. I mentioned before my Korean name is Hyung-taek, and then they were butchering my name, right? Because they, trying to go to a school that couldn't pronounce how to say Hyung, they call it Hayung. There's something that couldn't announce appropriately, and said you need to come up with some American name. So, we're trying to keep initial HK, Hyung Kim. So it's so I was thinking about first name words, that first name that start with the letter H, and there weren't a whole lot of options. I mean, you had to think about letters, something like Hal or something. Yeah. So we decided to decide with Henry because it was a great king's name. So I think that's why I chose Henry. But throughout the process, from junior high school and high school, we were trying to assimilate. We're trying to fit in. And as you mentioned before, when we got to college, then we kind of find other people who are like-minded and in a similar boat. Throughout the whole, education in high school and college, I think that we are struggling with how to assimilate in this country and yet identify ourselves, our community, as somebody who is holding the value. I always joke that that A- is Asian fail, and and we were just told to study hard, get a good grade, and that's our pathway to success. And during that time, what we realized is that we lose that identity of or trying to actually meet both sides of how to succeed in United States in this community while keeping the identity of being Asian American. So I think that struggle kind of continue and still continues today to kind of ensure that we are not only ensure care for all county patients, all LA County patients, but also keeping the core value of being Korean American or Asian American.
Can I ask a question about that? Actually, interestingly enough, in preparation for today, I looked up what are common perceptions of the AAPI community, and this idea of a model minority came up, of Asians being studious, educated, well off, well-to-do, and then you have movies like Crazy Rich Asians, and you mentioned that a little bit of like the A- was Asian bad. How do you think that has shaped kind of the community in itself?
Yeah, I think I think at the same token that we were told to not to cause trouble, right? When you see things, it's not Asian character to come out and outspoken, trying to point out things to stir the pot. We're trying to when somebody kind of does make a remark, we often just kind of smile and just let it go, rather than actually correct them in the spot. I think those discussion really started taking place now after all these incidents, that we see things and things are being pointed rather than just letting it go and smiling and then just letting it go. It's also you talk about some of the movies and oftentimes that we see Asian women with some colors hair and then they're always the rebellious ones, and I think it's stereotyping in the media as well as kind of from the society, that we look at Asian as certain types, and then when they kind of move out of the type, such as highlighting their hair, they become rebellious.
Yeah, when you say something, I think there's a bigger discussion about the media, right? How Asian Americans are portrayed in the media versus maybe how Asians are portrayed in their homeland, whether it be in the Philippines or in Taiwan, China, or India. Does anybody have any comments regarding maybe from another country, how the lens of your own ethnicity is portrayed and how there's such a difference in how Asian Americans are portrayed within the American culture?
Well, I think I can resonate what Henry was saying. Like, growing up from a traditional Chinese family, what I was taught always like the Confucius, moral code, with the virtues of respect, kindness, modesty, honesty, and with strong family values. And that's how I have to say I had also taught my kids, and for them to be honest, not really to confront, or even they're not encouraged to speak out loud of their different thoughts and opinions, because it will be considered as disrespectful. However, with a lot of pressure, and like with my younger daughter, she's in college. Even in college, in one of the classrooms, one time, like last year with the onset of COVID, there were other kids in the classroom saying, "We're going to stay away from that area. It's the COVID area." Like what we have heard a lot on the media from our previous administration about China virus. So media really definitely play a significant role in that.
So I guess for me, I still personally have a difficulty in America in really defining my place, because I don't consider myself Taiwanese, and I know that my greatest offering to America is not just pure American, right? So I do have some heritage from the entrepreneurial spirit of my father and my mother and others in my family from Taiwan, and I could see the lineage from that. But yet we bring some of the greatest things to make Taiwanese Americans great here in this country. So I guess my question is, which community in the United States do you resonate with? Okay, and is it purely your ethnic, racial community, or a combination, or are you having difficulty, such as myself, in identifying this Taiwanese American community, whether it be second and third generation, where they are American, but they do have some connection with their ethnic roots enough to really have a community that can hear what they're going through and what they're doing.
I think this is a common sense, and I can really relate to what you're saying. In the Indian or South Asian community, we have this term ABCD, which refers to American-born confused Desi, right? Desi means someone who's from South Asia or India. And, I think that is what I relate to, right? I have the values, at least some of the values that my parents brought, and sort of the rest of my family brought from India, and their culture in India, which differs from other people's cultures in India. But I wasn't. They didn't press on it, because there was a real move to assimilation, especially in places that I lived, like the Midwest and the South, where there were not large communities that were not black or white. And so, I relate to people like me, and I probably lean towards relating more towards sort of American culture, but it's not complete. And so there is, I don't want to say I'm lost, but I am in, I've got one foot in a bunch of different places. I'm a bit Indian, I'm a bit, American kid growing up in the 80s. I sort of think of myself as a bit Southern. And so, I think there are all of those things. And I wonder sometimes how, for, the kids of our generation, how that gets passed down to them. What do they see looking sort of backwards?
So I'd like to make two comments related to what Arun just said. Within the Japanese American community, there are some interesting dichotomies, because if you talk to people of Japanese ancestry in Hawaii, and I think Cal referred to this when he was talking about his ancestry, people in Hawaii of Japanese ancestry always refer to themselves as Americans of Japanese ancestry. They never say, I'm Japanese American. That's a West Coast or mainland terminology. And that has to do primarily with the war, right, during the Second World War, because, people of Japanese ancestry on the mainland were incarcerated into camps, whereas people in the islands were not, primarily. I mean, there were some people that were incarcerated, but primarily they weren't. And those in Hawaii basically worked very hard to sort of promote their patriotism. So I'm American first, I'm Japanese second, kind of thing. On the mainland, it's interesting, because the second generation, the first and the second generation of immigrants and Americans were incarcerated. The older second generation were more traditional, because they were raised by their parents, but the younger ones came out and they were like, oh, screw this, I have to be more American, or else I'm going to get screwed again. And so they tried very hard to shed their Japanese culture and their Japanese heritage and focused on being American. And it's interesting now because their children, the third generation, are now very curious about their heritage. And their parents can't help them with that, right? So they have to go into the community and go to places like the Japanese American National Museum or the Cultural Center or wherever to start to learn more about their own culture, because their parents, or they have to go to their grandparents, right, for help, because their parents are unable to do that. And so part of that idea about your environment, where you were, sort of molding who you are and shaping your values is very, very important. The other thing that I always like to point out is that, to me, education is always an important component about, trying to combat racism. And one of our biggest problems is our educational system in the United States. Like, history is always taught from a white perspective. So we don't learn about the contributions of other ethnicities, right? And this is a melting pot. We all know that. Yet somehow everything we learn in class, K through 12, is always from the white majority perspective. And it's very rare that we talk about contributions of other groups, particularly Asian Americans. And so I think that's something that has to change if we really want to combat racism.
Yeah, I want to dovetail what Richard and Arun said. My roommate in college was a fourth generation Japanese, and he was sharing a story about his great grandfather who came from Japan in early 1900s and kind of traveled around the United States to kind of figure out where to settle. And he landed in Alabama. I believe it's in Mobile, Alabama, or some Birmingham, Alabama. So he gets off the train and he needs to use a restroom. There's a restroom for whites and there's a restroom for blacks. So he didn't know exactly where to use. He was, and I think that kind of led to where we are now, right? We're not, almost a lot of Asian American doesn't feel like they're in either pocket or bucket. That we're trying to kind of see, where do we fit into this society?
Yeah, I think that's a good point. I think even within Asian Americans, I think there's subgroups within Asian Americans that really don't get that type of recognition, and I think one of them is the Filipino group, right? So maybe Annie, you can talk about like this, because I think we see a lot of Filipino Asian Americans that also struggle in really trying to have some identity regarding where they are in their place in America. And what has been your experience and your heritage in defining you and your community?
Thank you, Dr. Lee. See, with me, I came to the United States at age 16. My parents instilled Filipino values. So I was very much aware and I'm enculturated. But when I was, when you're growing up in the United States at age 16, you gotta have to assimilate. You have all these American friends and you have to talk the way they talk because, I don't know if everyone is aware, Filipinos have a very strong accent. And when we talk the language or the English that we use is very formal because that's what we learn in school. We don't use street type of or very casual kind of conversation, the words that you use that you're having conversation with a friend. We always have learned how to use terms that are very formal. So when I started talking, I remember growing up and I started talking in that type of a language and a strong accent. They could not understand me. So the way I had to do it, like I made friends with a lot of Americans and I had to assimilate myself and have to kind of listen to how they speak the language, speak the words, and being a teenager, that age, you easily assimilate, really. And so I was able to get it, basically how they talk and how they do things. And so my parents had a hard time with that because they consider that as you're now Americanized. Just because I adopted the type of the culture that the American, culture, I adopted the American culture, and they thought I forgot how to become Filipino. And actually, with me, I really, to be honest, I enjoyed having both cultures. I love, I love our Filipino food. I can't cook, but, I love them. I love Filipino desserts. And I love our music, and I still listen to Filipino music even up to this point. But at the same time, I really didn't just become friends with Filipino group. I don't, I embrace all cultures really. If you ask me, I have a African American friend, I have a Hispanic friend, I have a Thai friend. I mean, Hispanic friend. I mean, it was just, for me, I enjoy that because then I enjoy, I'm going to talk about food again. I enjoy different types of food, different types of music. I mean, I love it. And this is why, to be honest, I like being in California because we're so diverse. And also, and I love being at LAC+USC Medical Center because we're so diverse. Our patients, staff are so diverse that I just enjoy that. I don't think I would want to go anywhere else but in this state but in this hospital. And I don't know what my parents would call that now, but I embrace both cultures. There are certain values that I really, like for Filipino values, we're very respectful of elders. I could never call you, hey Andy, I just called you just now. But even, yeah, but Dr. Spellberg, here he's gonna kill me, but if I say it again, because he would always tell me, Annie, Brad. Because it's just that our culture, we're always super, respectful. So that kind of stuff, at the same time, I have that American side of me where I just, I'm relaxed, I'm outgoing, that kind of thing. But if you're gonna, for Filipino Asian, usually they're reserved, they're passive, but I kind of like have both. I can be outspoken, but at the same time, I can be reserved at times. So
can I make a comment regarding the, when the people have said about the model minority, and also we talked a little bit about the media, right? Sometimes it's you become the path that's paved before you, and I think clearly there was a formula for being successful in the United States through education, and actually not making a ruckus, and just obeying the rules, right? And I guess I wanna just ask this panel here is that, are we self-selecting our voice to the people that's been successful through that pathway? Because I know a lot of friends who are Asian Americans, Taiwanese Americans. They're not quiet. They're actually very loud. Okay, they do not follow the rules. They are outspoken. They're creative. The last thing they want to do is to be in healthcare, and that's part of our culture. But the problem is, for the ones that's been successful under the rules of America, somehow we've been kind of almost amplifying that piece of the voice versus actually showing the diversity of who we really are. So does anybody have comments regarding that form? Maybe Dr. Samo or Dr. Yi?
Sure. So I mean, I'm glad you mentioned that, because I think like over the last 3 years, I've realized I am a product of the investment my community has in this country. We were never taught to assimilate. We were always taught to be respectful, but our elders always taught us to never forget who we were. So we've run into problems because of that. We become marginalized when you don't want to play by sort of the mainstream rules. I just happen to be able to navigate that easier than most of my community, and so I went into medicine because I was a geek. Things made sense to me. But I have to tell you, when I got into medicine, boy, did they remind me that I was a Pacific Islander. They reminded me I was Samoan. So I went to the University of Washington, um, and you know, I was excited, gung ho medical student, and every time they had a case about obesity, slip capitis femoris, diabetes, gestational diabetes, stroke, it was always a Pacific Islander, and more so a Samoan, right? And I could tell I was the first Samoan to go to the school because all of a sudden, all the eyes would turn on you, and it was like, oh, now we have to be careful of our language, because they're in this space now, right? And I realized that uh, Pacific Islanders are very different from Asians, but we lend our voice because just like Asians, we're often invisible statistically. Yeah. And so Asians have carried our voice in spaces that we don't commonly show up in, right? There are more NFL players than they are Pacific Islander physicians. Yeah. That's a horrible statistic, but that's the reality of being marginalized in this country. And so, how does that affect us today? NHPIs have the highest rate of COVID um, in California. They also have the highest rates in 16 out of the 20 states that disaggregate and PI from Asian American data. They have the highest mortality rate in 11 of the 19 states that report NHPI data. So this this idea that you know, if you think of healthcare and access as the ivory tower, um, we're so far away from the ivory tower, we can't see it, you know. And so we lean on our Asian allies to speak up for us and bring us to the table when they're at the ivory tower, you know. And so, we most Asians, like or most Pacific Islanders, like I say, they don't identify as AAPI, but they will come out in the groves to show their support and denounce the violence against our Asian allies. Yeah. Um, and so I think that's kind of where Pacific Islanders are starting to move into, is that COVID is the reminder that we need to increase our capacity or we're forever going to be marginalized and we're forever going to be left out of this discussion. And you can see it currently, even though we have the highest rates, um, we're not on the national strategy. They've identified us as a high risk group, but we're not on the COVID, we're not in the Biden administration COVID strategy. We're not even in the California state, even though we have the highest rates, in their community COVID advisory. Like none of our voices are there either. And so, it's I I think it's important for us to have these discussions about intersectionality and sort of, you know, speak against the monolith of this Asian American and Pacific Islander identity, because a lot of these nuances, if they go left unchecked, there's a huge injustice that's brought upon these communities. Like Filipinos and Southeast Asians, their rates are very close to ours, but they get hidden under aggregated data, you know. Um, and so uh, that's how that's my lens that I look at. And like I said, would I be very happy just to be a physician in California and LA? Absolutely, I would. But the times call for us to sort of go into spaces we're not comfortable in being. I have no business leading an infectious disease task force. I'm an endocrinologist. And all of a sudden, I'm speaking to Congress about the needs of my community, none of which I choose, right? I prefer to work on diabetes protocols and look at the relationship between cancer and diabetes. But because we're so limited, we're asked to sort of show up. So when we can't show up, I appreciate that our Asian allies, speak for us and do their best to try to bring us to the table.
I've been thinking on what, many of you have commented on. And I think it's complex, right? It's a series of matrices. So, Andy, you talked about the diversity of Asian and Pacific Islanders. There's no question that the different cultures engage with America very differently, right? Because they're so different. When I think about India or China, the subpopulations within each of those countries themselves are different, right? I mean, to say somebody's from India or somebody's from China is kind of ridiculous, right? That's like saying somebody's from Europe. So you have that level. I think the other level that I reflect on is where each of us come from totally changes what our perspective is. And Richard touched on this. I grew up in Hawaii. I didn't know what Asian American was until I went to the mainland for college. In Hawaii, there's no majority. Everybody's whoever they are, right? They see each other as who they are. That's not to say there's not discrimination and stereotyping and racism. It's probably greater in Hawaii than anywhere because every single person in Hawaii knows people of all the different races. So they do stereotype. There's no question they discriminate. But there's something about each of the different groups living together, understanding, having that dialogue, which really changes your perspective. And so I was imprinted in a perspective of, well, we had been there for 100 years. We were no different than anybody else. Why should we expect anything different? Then I go to college, and I went to college on the East Coast, and I think where I went to college probably had 6% Asians, maybe 3 Pacific Islanders, and so I go from a place that has 50% Asians to 7% Asians, and then I recognize that even the Asians there were different, right? So there's somebody, that was in college with me, a guy named Jim Kim. You may know him as the former president of Dartmouth and the president of the World Bank. Jim came from Muscatine, Iowa, and he and his brother and sister were the only Asians in the whole town. And he was the quarterback and the captain of the football team. So he had no idea about racism when he grew up because he was the captain of the football team. He was an N of, his family was an N of 1. So they didn't see them as Asian. They were just the Kims. And then I, met a lot of the folks who came from urban areas of New York City, of San Francisco, of Boston. And they literally grew up in places that we would consider ghettos, right? Chinatowns. And they very much had the perspective of, Asians who were discriminated against, immigrants who were discriminated against. And so it really completely changes the lens that we all think about these things. And I think we have to keep that in mind. Anyway, I think this is very complex, and we do have to look at both where people come from as well as where they grew up, because that makes all the difference. And obviously, I never got the teaching that I was supposed to be polite and diplomatic and passive and quiet.
I think we can all attest to that now. I wanna actually touch upon allyship that Ray you talked about. Maybe kind of open this up to the rest of the group. In your history, who were your allies in the way that if you ran into something in the domain of racism, who were your key allies growing up? Which community, which group? Maybe you can mention a friend or an incident.
I have to say that I didn't have any. I think all through K through 12, I think there were 3 Asians in each, at each school I was at. And I never really associated with them. All my friends were white or Hispanic or some other race. And that had mostly to do with that, like I was the only Asian in my class. The others were either upperclassmen or lowerclassmen. So you never associated with, somebody in a different class. So growing up, I really didn't have aside from my network of friends that, obviously, were a great structure to support me and encourage me, etc. But, I really never had other support groups or whatever that I could count on. But
So I think at a personal level, I think for me growing up as a kid who was the only, I think, Taiwanese American in my class, I think I shared the same experience like Richard. I felt I was kind of on my own, and I did have a lot of friends that did look out for me, but when it really came to something that was racial, I don't think people knew how to really support me, right? So I think as a Taiwanese American, you just took it. You just who's gonna actually understand your roots? You don't even understand yourself, right? At the same time, when you're at home, you're educating your parents, right? Because they don't share the same experience, and so when I look at how things have changed, and one thing that kind of strikes me is that we're probably Los Angeles per capita has the biggest Asian American community, okay? Chinese being one of them. And this question I'm going to ask for Anna is I still don't feel that there's a unified Asian American voice. And even within Chinese Americans, do you get a sense that in Los Angeles there's a unified Chinese American community that supports you or other Asian Americans? What has your experience been?
Well, not particularly. I think in a lot of ways, in our culture, we really emphasize the family value. And I want to say that as, I immigrate here in a relatively later age, but then my siblings, they came here even later. They experienced more of that kind of discrimination, perceived. And when they had, all their kids in school have problems, they come to me, and I do want to find some of community resources. They're scarce, and I want to say also a lot of times it's not just offering the support, and it's really important to offer them the tools, offer more opportunities for them to learn the culture and the history, and to learn for a lot of immigrants the language issue. So unified, more support in the community and the outreach would be very helpful. I also want to add, a lot of times people do go to some kind of church group to get support, but no unified voice.
Can I ask about mental health resources? Because it sounds like a lot of things that we keep talking about here are that there have been times where it's been difficult and a struggle, and that there may not have been as much support as we would have liked or could have been helpful, and that the resources may or may not have been there. What about seeking mental health? And I know about kind of your history and where you were working before and the community that you were serving. Can you maybe talk about that a little bit more?
There are definitely strong, stigma towards mental health illness, because even you're going to see a psychiatrist is considered as crazy. People usually with some insomnia, pain, they go to see a neurologist first, or they think it's a somatic, physical concern. Also, I think language is a big barrier with the resources not readily available. And a lot of times when people come to see psychiatry, it's when they're very late in a stage of illness, and when they're really, really severe. They have actually missed a lot of years that they could get help. And Chinese family also tend to be more, in a sense, you want to say protective, but not particularly. They, kind of provide another family support to hold them together, even though they tolerate a lot, sometimes even abuse of some physical fights from, patients who are suffering really severe mental illness, tolerating their aggression to the point that they cannot handle it anymore. That's the time when they get help.
Yeah, I think with I don't know if like this in other Asian cultures, but I think my mother and grandmother would be the last person to want to go to the hospital, or the last person to, if they're in tremendous pain, to ask for help to go to the emergency room, right? So they tend to keep that to themselves, and I think this is part of the invisibility, right? It's part of the culture to really look after yourself, to be self-resilient, and a lot of the invisibility, whether it be in census or just the voice of Asian Americans, at least for me, Taiwanese American, many Chinese, that they don't speak out. And it's part of the culture, and part of it is being a first-generation immigrant. But can some of you comment on that regarding just maybe there's some cultural tendency to just keep a lot of these things to themselves, whether it be mental health or just anything that appears to be just kind of out of the norm?
So, mental illness is, definitely has a stigma attached to it, as it is. I think it's even more so in our culture. Just going back to what Dr. Kim said earlier, that, in our families, there's this very, a lot of emphasis on doing your best and achieving a whole lot. And so there's a lot of Filipino nurses, because that's our way to be able and have that opportunity to be able to do well and be able to provide for your family. So if anyone mental illness is something that you really don't talk about. At least certain illness you don't talk about outside of the house, outside of your family. It's not something you talk about and say, oh, by the way, my son has mental illness, or my mother has mental illness. It's something that you keep within within the family. I don't know if that has anything to do with, because we're supposed to be perfect. We're supposed to be, has achieved and successful and well-to-do and achieved the highest education and so forth and so on. And so that is why any kind of imperfections are not really discussed outside of the family, even amongst your relatives, because you always talk about like, oh, you go to a Filipino party, oh, my daughter is this and my daughter is that, and sometimes I would tell my mom, not really, but that's because they're just so proud, and for all the achievements that you have made, and then they would never ever talk about the other problems, other issues, whether it's social, socially or physical illness, disabilities, or anything like that. That's something that you don't discuss, or at least share with others. And so going back to allies, so you kind of like, because you're not able to verbalize all of these things freely to other people, so then the tendency is to kind of keep them within, and the support that you need may not necessarily be there because you keep things within the family. It's not something you talk about outside. So that's my experience.
But that also plays into this whole thing about, for not all, but for many Asian cultures, that again, you don't stick out, right? This sort of homogeneity that is trying to be achieved at some sense. So you don't talk about the bad things. You don't, because you don't want to stick out from the rest of the group. And I think that also plays into the fact that, AAPI groups have a harder time supporting each other, because again, you don't want to admit there's really a problem, and you don't feel like you don't want to go ask for help from somebody else, which I think is a big flaw, because we do need to be supporting each other. We're especially in I think Andy mentioned how multicultural Los Angeles is. I always use that as a recruitment tool when I'm trying to recruit students or faculty. I tell them, I ask them a question. I said, do you know how many languages are spoken in Los Angeles? right? And people are surprised when I tell them it's like 220 something, right? And I tell them, there's no one-to-one correspondence between language and culture and food, but just think about what that means. That there are all these different people out there, and so there's racism, and then there's racism, right? It just depends on which groups we're talking about. I was sort of laughing when Henry talked about his friend's father, excuse me, because I heard from World War II veterans, Japanese Americans who served in the 442nd Regimental Combat Team. So they were sent to Fort Shelby, Mississippi for basic training. And then when they got their weekend passes, they go into town, right, to go catch a movie or go eat or whatever, and they saw the same thing, right, colored, white. And they're standing outside, and they're like, well, I know I'm not white, right? And then the boys from Hawaii, right, because they're tanned, so they figure, I'm colored, and so they were going and using the colored drinking fountains and the colored seats and whatever. And their commanding officers heard about this. And this is a segregated unit, right? These boys could not get above the rank of lieutenant. And so all their officers were white, and so the white officers find out this is happening, and they tell them, no, you're white. You use the white seats, you use the white drinking fountain, etc. And the local towns were explicitly told to treat them as white because they were a necessary asset for the war. And so they didn't want to disillusion these boys by segregating against them. But they immediately knew this is wrong, right? Because clearly there's another segment of society that couldn't use, anything that they wanted. They had to follow these signs.
Yeah. I mean, that's I grew up in Mississippi in the 80s, and there was sort of the aftermath of the civil rights movement, and it was really interesting because I think our community didn't look much for allies, as many people have talked about, but we got people see what they see and group you somewhere, and I think we actually got grouped into in with white people and with black people, because to some degree people sort of project their own view, and I remember I knew this girl when I was in high school whose family was from Mississippi. She'd mostly grown up in Chicago, and they'd moved back, and she complained about her parents being racist. And I said, but your parents have met me, and they really like me. I mean, I know that. And she said, yeah, but that's different for them because you're not black. And at the same time, my parents will tell you, they worked at a hospital much like LAC+USC. They were both doctors. And most of the support staff was black, and all of the faculty was white. And they would say that the support staff sort of took them in as their own, right? And my parents would say that it was much easier for them to get some things done in the hospital because they knew the right people, and those people related to them. And it wasn't about knowing people in power, it was knowing about people who actually pushed the buttons and levers and made things happen. So it's depending on where you are, and you probably had some of the same experience, Andy. There were a few kids, who were Taiwanese in your area too, that you kind of get shuffled around, and you yourself end up going, I don't know where I align. And in some ways, it's great because you don't, and in some other ways, you end up feeling very isolated.
I just want to circle back to kind of what we were talking about, the kind of heritage and the problems we're facing now. And I look back at my childhood and looking at my community, that we don't seek out help. Like, help means that opening up, and you don't want to open up your dirty laundry. Just like my parents, and like looking back at when I was younger in high school, we could probably qualify for some sort of a food stamp or some sort of aid, but parents are too proud to ask, or even don't know how to ask, or even even they try to ask, no one could actually guide them because there's a language problem. So I think a lot of things just lead to like not asking for help, and it's like myself as well. I don't ask for help until there's something that I can't do. I guess I try to do it, and it's typical. You see this in movies, as we talk about in medias before. They get mad and mad. You take it as much as possible, and then they explode. Right? So, and seeking out mental health is like taboo world in Asian countries and Asian cultures, right? So which means that we hide things to the point where things just got so bad they can't handle it. And working in the emergency department, when I see a elderly Asian person coming in, as soon as they hit the door, I know they're getting admitted because they waited until they're like super duper sick, and to the point I'm like, how are you even alive? So I think there is that type of culture that we hide things. We shy away from the problems and asking for help. Help means just opening up your dirty laundry. So but also same token that we do have an opportunity to actually channel that. Speaking of the working in the emergency department, when I see, I was called to see a patient, and they overhead paged me to go see this patient, and I was wondering what it was as a medical director in the emergency department. So I thought we're gonna run into a bunch of problems. They want me to help translate. I was like, seriously, you want me to help translate? But then the patient was so grateful, right? Because then they had a laundry list of things that they wanted to say, couldn't actually communicate before, And they while you are here, can you help me out with getting my mammogram done? And so I think that that we actually have an opportunity to kind of be that the rod to kind of guide them, because we actually do cross both culture in have an opportunity to looking at our community from our ancestry, or and then looking at our current environment, whether it's work or or American community, that we actually have a both foot in, so helping translate both between those two areas.
Yeah, I couldn't agree with you more. I almost feel that we are kind of the first generation of ambassadors, right? And I remember the first time I brought an African American friend into our home, like with my mom, and he was a really great friend, and it took her years before she could accept something like this, but I felt it was right to do it. I said, come over to my house. I'm not going to be going over to your place. I would like for you to join us, right? And I think this is one of the things at LAC+USC, right? We've kind of been there in these situations, and I see this with our patients a lot, that they, especially Asian American patients, they get to the point where they can't handle it anymore, and they reach out for help, right? And our system, sometimes if people don't have that type of experience, they get a little frustrated with these type of patients because it's very hard for them to intersect the healthcare system. And our healthcare system, it can't receive not just these people, but also their they don't have the right type of navigators to help them understand our system, right? And we become the ambassadors to really design new things, or have empathy enough to say, we're not perfect, but we're going to get there. And I think we're kind of the first wave of that type of Asian American generation to have empathy on both sides, right? To understand that there are a lot of people who don't understand the issues of the Asian American diversity. At the same time, we understand that there's a lot of Asian Americans, due to language or poverty or other things, that's been marginalized for years and are not willing to speak out.
I wanted to echo what both you, Andy, and Henry were getting at. Maybe the only thing in common amongst Asian and Pacific Islanders in America is that we don't ask for help. And that, is a challenge in these kinds of situations.
I just wanted to say that I had a different experience, with the from you. I was in psych hospital as a staff nurse, and so the physician and I, psychiatrist and I, decided to interview this patient, but this patient could not speak English, so we got a translator. So our physician, our psychiatrist, started asking all these questions, And then so the translator translated, what he said. But it was just like, it was a long conversation. So he and I were like looking at each other. I said, well, it was just a one question. How did that have to be like a long conversation? And they were already they were at it, like going back and forth. And then so finally, so at the end of it, so we said, okay, so what was the response? And here I am like, charting and everything and see what he would say. Oh, there's no more problem. He said that, I told him, you can't be suicidal, stop it, and you gotta have to, not do this again kind of thing. I told him he's okay with it, and that's that. He's done, he's healthy, and he said he can go home now. So it was just that conversation. Again, it goes back to a translator who's not a physician, who's not a nurse, who actually had this conversation with his patient and said, you're good to go. You don't have any problems. It's just your imagination kind of thing. But that was just my experience I want to share.
That's really interesting. Talking about both the allyship and asking for help, I think that's the moment that we're seeing. And I think we're seeing it, you and I talked a little bit about this on the phone the other day, Andy. We're seeing what we think, but we don't even know because no one has measured it effectively before now, and even now not very well. We think we're seeing a huge increase in aggression and violence against East Asians. It might not actually be that much of an increase. It may be the ascertainment bias of actually noticing that it's there. We don't know. I suspect it's actually an increase. I suspect it's some of both. But we're seeing the moment where I think because of a confluence of circumstances, having to do with politics, having to do with, sort of social justice movement, that it's getting highlighted in the Asian communities rightly are saying, look, there's a problem here, and we need you to look at the problem, and we need you to support us in some way, right? And we'll figure out what that means, right? And different people have different ideas about what that means, and we hear, sort of the same discussion with the Black support movement and people sort of saying, how do you become anti-racist? And some of the conversation is the same and some of the conversation is different. But here's the moment where I think Asian people, and particularly East Asian people, are saying, okay, that's enough, right? We're actually here. We actually deserve respect. We actually have a viewpoint, and we actually need your help in that.
Yeah, I agree. I just want to bring up actually, I don't know if everyone knows about what happened in San Francisco with the lady Xiao Shenxie, the 75-year-old female that fought back after an unprovoked incident in San Francisco, and the fact that on the GoFundMe page, it was nearly $1 million that was raised to help her. She gave all that back. She gave all that back, right? This is how tough that generation is, and kind of like what Henry said, you get to a point where people say enough is enough. Like, we can only take so much, and we need your help, right? And I do think this is a different political, maybe also just it's a different moment in history, and just trying to understand as a community for AAPI, what really is our next step? Okay, if there's other non-AAPI members that want to have an allyship with you, they want to support you, they want to help you, what would you ask for? So maybe that's a question that I would ask all of you to maybe just briefly comment on. If you had to.
I don't know if this is well, it's definitely not answering your question. Sorry, but but I agree. This is definitely a different moment in history for the AAPI community for a lot of reasons. And one thing that plays into this, which I've put a lot of hope into, our young people. We've sort of been discussing everything from our own perspectives, and quite frankly, I hate to say this, but we're all old, right? And we're sort of looking back at our experiences and how they've affected things. But young people, overcome a lot of the differences that have separated AAPIs in the past. And they've grasped this moment to organize and try to move forward. They need help in better organizing because there are little clusters all over the place. But I'll give you an example of a friend of mine, a very young friend of mine, who actually graduated from USC, started her own clothing line and an urban clothing business, and then the pandemic hit. And so her business was sort of put on pause, but she noticed, along with some of her friends, that like in the early days of the pandemic, Chinese restaurants and Asian businesses were being targeted, right? People weren't frequenting restaurants, etc. So she grabbed a bunch of her friends and organized and started to do food crawls to visit Asian restaurants that seemed to be not doing well, to help support them. And then when shutdown orders came, they couldn't do that anymore. And then she and her friends again sat down and thought about it and organized and reached out to other young friends. And they created this group called Hate is a Virus. And their goal is to support Asian Americans in all issues DEI related. And one of their main campaigns right now is they're trying to create a what they're calling their community fund, in which their moniker is community, but the unity part is in caps, with the idea that we all need to unite. And they're trying to raise funds to like $1 million to support Asian American businesses that are hurting because of the pandemic or because of anti-Asian sentiment or whatever it is. And that group, Hate is a Virus, has now reached out to other of these young people that have created these disparate groups across the West Coast and across the nation, and trying to build that network so that they can better organize. And frankly, I've been very impressed with what they've done. And I think they could use some help and some, from maybe some, sagely advice from those of us that are in positions to do that. So I have hope, as bleak as things look right now. I mean, I remember growing up, I would hear, get the taunts, the same ones that we hear today, right? Go home, go back to where you came from. And then I stopped hearing it for a while, right? All that stuff it didn't go away, right? It went into the shadows. And our recent political discourse, and quite frankly, we've had a total lack of political leadership, and we've even had political complicity that's allowed racism to come out of the shadows and thrive out in the open again. And it's not just the AAPIs, right? It's everybody. It's just that right now with the pandemic, there's this focus on it, and the underreporting of incidents. I've had friends, and acquaintances just tell me that they've been told, you go back to where you came from, Kung flu, all this other stuff. It's getting worse. And you've seen the data that's been reported in the media. It's clearly underreported, and everyone understands that it's underreported. But this is a moment where Asian Americans really have to unite and take a stand. And I think it's a unique opportunity where, again, I think I was telling Dr. K earlier before we started, it's like young people have all that energy. I don't have the energy anymore, right? But young people definitely have the energy to do this stuff.
But you have sage advice.
You talk about young people. I'm talking about young people. My son is 10 and my daughter is 6, and racism is learned, right? They're not born with it. And then, my children's, are sometimes taught me that's like mental health is not a problem. Why don't you go ask for help? And and they're very open about it. And I think that the education starts early.
Anna, you had a remark.
Right. I don't know if I will answer your question, but I'll go ahead. I lost my sister to COVID in August of Thank you. August 2020, a few months ago. And interestingly enough, she survived cancer, but didn't survive the pandemic. And if anything, I learned about her death. And because she and I are close. We're 6 years apart. And we had plans. Her kids were. I don't have any kids, but her kids are telling us that they're going to put us in one convalescent or one apartment, one house, and like a duplex, and so and so that we can be with each other. And obviously, that plan is not going to happen anymore because she died. So one thing for sure that I learned about that is life is too short. And I didn't have any hate in me. I didn't start hating people. I think for me, we should declare war against COVID and not against each other. We learned in the recent pandemic that this virus did not discriminate. You could be the wealthiest person, or you could be of this race and that kind of thing, although it shows that there are more people affected in certain races. But my point is that this is the enemy, and we're not. None of the races are enemies. So we should really be for each other. And for me, it's not just, the Asian American and Pacific Islander. I think all of us have to really come together and stop the hate, As a nurse, I see a person, I see a human being when I provide care to that patient. I don't see anything else outside of that. And I think that is important as a healthcare provider for this hospital. But if I'm going to say anything, if I would wish on something, is to tell people, stop the hate.
Yeah, I definitely connect with that, and I'm so sorry for your loss. Just this week, actually, this Wednesday when I have my diabetes clinic, I generally, it's a telephone visit, right? And I was actually late to that telephone call, so I called this patient 15 minutes past the time I should be calling her. And when I called her, she's African American, and she said to me, "Oh, I thought you weren't going to call me." Okay. And I said, "Why? I'm apologize for being late, and but I'm here now." And she said, "No, it's just I thought Asians are hating blacks." Okay. And I know there's a lot of hate, and I've been telling people I love my Asian doctors. and she was crying, actually. She was just like I'm so sorry what's happened to you, but I don't have any hate, or I love you guys, and and she wanted to tell me that, and what I said to her is exactly what you said. I said, I see you as a person, okay, and I will always see you as that vibrant person, right? I'm your doctor, okay. I so happen to be Asian American, but I'm here to see you as a person and heal you as a person, and I appreciate that. And I do think COVID unifies us all, and looking at what's important, and what's important is, we need to kind of bring humanity forward, and that should be very American for us to go beyond racial the racial segments of our society. So,
Dr. Lee, thank you so much for sharing that story. And I wonder, as we wrap up here today, if we can all just kind of go around the table. You all are all in leadership positions, and you have a lot of people who you supervise and lead and kind of help through working through these things. If you could share an experience, maybe with a colleague or somebody you supervise within your department, or even a patient experience that kind of highlights the sentiment during this time and kind of how you have been dealing with it.
I actually worry that I haven't been, and I think I have the same concern about other people. And I think the story that you just told about your patient, Andy, is really, really important, because if you ask the question of what would you ask someone, and or what would you ask them for, and I think I would ask them for their vocal support, right? If you see something happening to someone on the street, speak up, right? And people are afraid to do that because they might get harmed themselves, and I totally get that. But also when you see that with your family, friends, whoever it is, speak up and say, no, my doctor is great, right? I had no reason to believe that he doesn't like me because I'm black, right? The thing I worry about myself is that, as an administrator, and I think it's different for most of y'all, but there are lots of people like me who are working from home, right? I go to the office once a week, I go to the hospital once a week, but the rest of the time I'm in the house. And so I can see the news when I choose to look at it. I talk to a few friends every now and then. Sometimes I get to see Henry when I'm in the hospital. But because we've been so isolated for so long, we are actually really isolated from this, right? It feels like a problem that is out there. And it's not a problem that's out there. And so the other thing that I think about when you ask this question is, for my own experiences, I've got to figure out how to feel more connected to the problem so I can feel more connected to what I'm going to do as part of the solution. And I think we need to work on making other people feel connected to it in the same way. It's not just out there. It's their world, and they're going to go back to it.
It's interesting. I recently, because of this incident, the shooting in Atlanta, and all the reports, one of my colleagues, Caucasian colleague, actually emailed me saying, I just want to see how you're doing and how is your family dealing with this. And it was very touching. And I said, yeah, thank you really for reaching out. And be honest, it's kind of scary to hear that. And you really feel vulnerable. It can happen to any one of us. Could be just the kind of my skin or my appearance, the kind of my hair or my accent or the language. It really kind of remind me how, this has also been for a lot of other ethnic groups. When we talk about the criminalizing of black, and how there's also not of our patients here, they live in the neighborhood with high crimes and high drug, alcohol issues, poverty, and how is it like for them? Really, I think reaching out and sharing and checking on how they're doing and encourage them to report and speak out. It's very important. And how this changed my practice with my patients. Even they don't bring up, I would ask, how are you dealing with the COVID? How are you dealing with all the media coverage and reported rising crime and violence? How we can help you.
I want to echo what Dr. Patel is saying. I don't think we have fully recovered. I'm not even sure if we're even near the road to recovery. The vaccine is there. That is great, and I really appreciate it. But the remnants of the impact of what COVID did to us as a society has not even, it just hit us so hard, like whirlwind that you're talking about, that I don't even think we have any time to pause or breathe. As a nurse and as a leader, when we got hit by COVID, our focus was making sure the patients would be okay. So we're coming up with all kinds of things, to open up beds, to make sure, the patients will be admitted, whoever need to be admitted, to, all kinds of creative things, innovative things that I would not even thought of. It's not even, we do have a plan, but that plan was not even, it's not the way we imagined it would be. It was totally different scenario. I've never, in all the years that I've been in the county, I've never seen this. And then after COVID hits, the first surge, second surge, and now that it's dying down, then we have to have we can't pause, because then we have to deal with those patients who we have to take care of nowadays, because they were kind of got put in the back burner because we couldn't deal with them because we had to deal with the emergent ones. So now we're trying to help them. And my fear is we're trying to do this, and I don't know if we even have the time to heal ourselves, personally and professionally. My nurses were tired, and I don't think they, right now we're dealing with other things, and so I don't think they even have gotten a breather, so to speak, and to be able to deal with their personal issues, the impact that COVID, hit them with in personal sense or personal basis, and also professionally. We do have our H3 at LAC+USC, and that helps, but I don't think it's a step, but I don't think it's been fully realized where we really need some time to really recover. And being in the hospital business, it's kind of like it doesn't allow us to have that, because we still have patients to take care of. But it is my hope that we'll find a little bit of time to really take a breather, pause, and take care of ourselves. And I think I hope that time would come.
Yeah, I share the exact same sentiment. As it was probably one of the biggest epicenter of COVID in the entire county. We've gone through these surge and waves. At this hospital, we just finished our last wave, and we're into recovery, right? And I think the healthcare workers we're burnt out, right? In the sense that just emotionally, physically, we're tending to our patients. Personally, seeing what's happening to the Asian American community hurts me because of what I see the frontline nurses and other healthcare providers have provided. And the thing that I would say is I was really, probably for the first time, kind of gratified to see that from the president to our director of healthcare services to the CEO stand in solidarity, that they acknowledge that there is work to be done. And I think just being visible in that way is probably the first time I've ever seen that for the Asian Americans. So I know we're all exhausted, but I felt this was good for us to have this conversation, because I think for the first time we are visible, right? Mm-hmm. And I think there will be others, maybe younger with more energy, to take on the baton, and we can be the stewards and the wise sage. But I think it is a very unique period in time. Henry, do you have some comments?
Yeah, I always have something to say, right?
I know you do.
So I go back, and about a year ago, when kind of whole pandemic when it's kind of started on, and I went to a Costco, trying to make sure that I have enough toilet papers and paper towels.
What is it about that?
I'm not sure, but and then at that time there was no mandate for a mask, and there were a couple Asian people wearing a mask because they were very used to wearing a mask. I had my mask on, and I took it off initially when I walked in because I wanted to fit in, right? And then I see these two Asian people walking in with mask, and of course, when I get nervous, I get a little tickle in my throat, and so clear my throat. I was like, and then people are looking at me funny, right? So I'm like, okay, I'm gonna put my mask on, and then people look at me even more strange. They're like, it's like, oh, he must have COVID now. So I think that perception of how how the entire general population saw me in that moment in the Costco, kind of looking at like how I should model myself. Just I think that just being a leader. As I said before, the children's are our future that that's gonna learn, but the adults are very impressionable too. So I think that I had to make sure that I set a good example. I wear a mask, and I wear from that moment on that before even the mandate came that I wear a mask. I work in the ED. I work in high risk. I intubated several patients that with COVID. So for me, I was trying to protect them, and they think that I have COVID. So I think that I think that what we do matter. I think that from the leader's perspective, we actually have to be mindful about what we do, what we say, and set a great example for the rest of the staff to follow.
Well, I want to thank you all, and I want to give Dr. Lee an opportunity if you want to say a few remarks, and then we'll end it here.
I just want to thank all the panelists. I know you're very busy, and I think COVID's been very exhausting. To be able to come on today to this town hall to really express your opinions and have this open conversation. And like I said in the beginning, I think it's a very difficult and complex conversation over groups that spans an entire continent, and I think it's important in this period of time for us to really acknowledge that we're getting actually visibility for the first time, and that people are speaking out. And like many of you said, it's a great time to stand unified against hate, and we have to move together as a group and to unify with our fellow colleagues and brothers and sisters, and to make sure that we actually move forward and make this a change moment in our time. So thank you guys so much.
Thank you all for tuning in today. I just want to stress that help is out there. Please make sure to call Care for County Caregivers, call for an H3, continue to tune into our podcast at House Calls with Dr. K, and join in next week for Schwartz Rounds for a special episode discussing anti-Asian American hate and how that is making you feel. And we do want to hear from you, so let us know if there's anything that you would like to talk about or how we can better continue this conversation.